It's 7:50. Brian Eben with you on this Monday morning. We are pleased to be joined now by Dr. Theodore Bailey. He is the Chief Division of Infectious Disease at GBMC. Great to have you on. Really appreciate your time and your insights here. I guess, we've seen this in the country now for, half a month or so. What do we know today about the coronavirus that maybe we didn't know last week?
Well, we do know that our testing, as we roll out testing, we're finding more and more cases. And so it's clear that there are cases that are very mild or cases that are even without symptoms, and therefore our sense of how extensive it is throughout our community was probably underestimated by the amount of testing we had previously done.
All right. Is it possible then that many people have this or had it and didn't even know about it?
That's entirely possible. And what helps us know that even better is the experience of other countries. And I think the leader in this is South Korea, who had rolled out very extensive testing from the start. Early on, we had been very restrictive. You had to have a certain travel history or a certain contact history. Korea had been much more open about testing, and as a result, found far more cases and therefore found far more mild or even cases with no symptoms.
So this is what I'm struggling with, and trust me, I don't know these things like you do, so I apologize if there's silly questions, but then does this mean that it's possible that we get through this faster because so many people have already been exposed to it, already have it, or have it now?
I wouldn't be able to conjecture about that because it's even though there's probably more of it than we know, we're still talking about a very large country, a lot of populations, and so that's not necessarily a recipe to faster resolution of the epidemic.
All right. So if you can spread it without having symptoms, right? Then what should you do as an individual? Because you never know really who might have it or if you have it. I mean, has anything changed on that front of what you should do as an individual?
Well, certainly an increased emphasis on social distancing, and that's come to us. We haven't had to go to it. We've seen recommendations from the CDC to avoid gatherings of 50 or above, but even below that, the risk still is present. Where we talk about community transmission, where there's cases that we don't know transmitting the infection, we've really put a premium on closing schools, closing gambling facilities, staying away from or limiting presence in restaurants or bars, limiting travel. And all of these things make it less likely that any one of us would come into contact with someone who might be infected with it. The other thing is if you yourself have symptoms, it's really ethically and medically required that you would avoid those kinds of settings.
Right. All right, we're talking with Dr. Theodore Bailey, who is with GBMC, the Chief Division of Infectious Diseases there. A couple questions regarding what people are doing right now, what people want to know about their kids who are out of school. And a nice warm day, this past weekend, the kids want to go outside and play. Can they go outside and play with their friends, or should we avoid that as well?
Well, although the risk would be low, I can't say that the risk would be none through any particular social contact, and that's something that's true in past years with other potentially severe respiratory illnesses like the flu. In the past years during flu season, there would always be some risk if you were in a social gathering. That risk goes down as the number of people in that gathering decreases. But it is a continuum of risk. There's not some moment at which that risk just drops off to zero with certainty.
Okay. The other question I had is you've read some places where you can get coronavirus, get better, and then get it again. Do we know if that's true, and how widespread is it, and how problematic is that if it is true?
Well, we don't know with certainty because we don't know how high quality either the supposed first diagnosis or the second one was, or is this simply redetecting the same virus in the person? So at this point, that's a little bit early in terms of the maturity of that information. It would be concerning, of course, that one could continue to get it, and that would make it harder to contain, but that information needs to develop a bit further.
All right, what are you doing at your hospital right now, GBMC, to prepare for possible cases of this at the hospital?
Well, so one of the things is for us to scrutinize the reason for patients to come in for outpatient visits or other visits, for instance, elective surgeries that are not urgent, and really try to limit the influx of individuals for things that can be pushed back without any detriment to their health. Then we've created, outside of our ER, we've created, what we call a triage station where we take in patients who are here with concerns or actually respiratory complaints that might be linked to it, or fevers that might be linked to it, and assess their history and think about, do they require testing for it? Are they mild? If they're mild, they may get tested and sent back home again. If they require hospital support, the kind of care that we can give for severe cases, they would obviously be brought into the hospital and admitted.
Is there anything you would want people to know that, hey, I'm watching TV or listening to radio and people talking and they didn't address something? Is there anything you want people to know about this?
Well, I think that recognizing that the mortality rate, that's the number of deaths that we see out of all the cases, it does seem to be higher than the flu. So this is a more severe illness than the flu, but it's also one that, because it's transmitted between people, can be brought under control if we limit our contact with other people. And so really taking seriously the recommendations from the CDC, from Maryland Public Health, to limit our gatherings and limit our interactions so that we can bring this epidemic to a stop.
Dr. Bailey, great to have you on. Thanks for your time. Appreciate it.
Thank you.
Dr. Theodore Bailey, who is the Chief Infectious Disease Doctor at GBMC, 755 on WBAL.